the right thing is taking care of the patient, period.
Right.
And then it's fighting with the insurance companies. But again, one of the things that I talk about with conferences, I'm talking about practice management and that CPT coding, get your patients behind you. We had here, AT&T had 22,000 employees in my geographical area, and their insurer was hassling us. So what did a bunch of us do? We put it out there to the patients. Go to HR. Tell them this is unacceptable, that my doctor, Dr. Land or whoever it is going to drop because you're doing this, which is not right. So HR, we're paying you. We work for AT&T. We're your employees, but therefore you have to go and talk to company X. And it does work. The other thing is going public. I'm a big one on that. I think if people knew, the public knew more was going on behind us and that we're not all rich doctors who do nothing. I got a call last night at midnight from a parent, horrible Kruger. I haven't seen Kruger for a while. The kid was really nasty. Am I getting paid for being woken up at midnight? No, but that's what I signed up to do, to take care of my patients.
You know what? They came up with this new thing called telemedicine. It seems to help. I don't know how much your experience is on it, but how do you think telemedicine plays into modern pediatrics? And how can practices bill effectively for this?
As the CPT codes are the same ones you'd use as your established patients, 99211 to the 215, depending on your level of documentation or the time. I personally don't like telemedicine if someone says, I got a fever of 104. No, you got to come in. I have to actually examine you. Now, I know that there are all these new apps like looking in the ear. There's an app for that. Listening to the lungs. I personally don't have those. I guess it would be beneficial. But the fact of the matter is, I think it's fine, particularly when dealing with mental health and behavioral stuff. Our daughter's a child psychologist. 8 people work for her. They don't take insurance. I'm very proud of her. But she hated COVID when everything was all telemedicine, because it's more than just talking to the patient. It's looking at them as they're reacting. So telemedicine, you're seeing the face, but you're not seeing them fidgeting with their fingers or whatever else they might be doing. So is it okay to use? Yeah, I think you have to use it appropriately. ADHD? Sure, I'll use it. Do I still want to listen to the heart to make sure they didn't get tachycardia from their med? Yeah. Or that I can see the hands if it's trembling when I ask them to put it out. All right. So I think there is definitely a place for it. You have to still make time for it in your practice. Right. And you can't say to the patient, okay, we'll do it at 2:00, because you might get swamped and you're not there at 2. So you've got to set aside specific time for telemedicine, whether you're going to do it in the morning, you want to do it at your lunch break, you want to do it at 5:00. So not to interfere with what's going on in the office.
Yeah. What we did is I have to credit Carrie Firestein for this idea. She said, just put it in the doctor's schedule, just like an office visit. There's nobody can complain about it then.
Yeah. But just unless your practice is very different than everyone else's, we almost never run on time. I'll apologize if I come in 5 minutes late to a patient. I'll tell them. I know lots of people who are sitting in the doctor's offices for an hour waiting to be seen. So what's that person supposed to do is a 2:00 telemedicine with you, and you didn't call them until 3:00. Oh, 2:45, I've got to run out to pick up my kids to school.
Yeah, that does happen.
So I think RBK does a good job in that. They see the AD kids twice virtually and once in the office. So you get a blood pressure, a weight, you can see you're actually putting your hands on the kid. And I think an obesity might also work, right? I just need to know how you're weighing, how you're feeling. Are you going to the physical therapist? Did you meet with a nutritionist? There's not much I can really do. It's a heart rate on a skinny kid, or an overweight kid, or an obese kid. I guess I'm missing out on the blood pressure. Some of these kids already have high blood pressures. Where it doesn't work, the time doesn't work. The time billing doesn't work in Virginia, in particular with Medicaid. And some of the commercial payers are worse than Medicaid in the amount that they pay pediatricians.